Hello, my name is Uni Lim, and I'm going to diagnose Margaret's case through this video. Margaret is a 32 years old woman who described herself as emotional and sensitive. She's very eager to sort her problem with the course of the therapy. She says about a year ago she experiences sudden and unexpected anxiety when she was out shopping. At first, it lasts just for a few minutes. However, after 2 weeks later, she felt the same thing but worse. Ever since then, she says that it is real effort to go out. And sometimes she experiences burst into tears for no reason. And when this kind of situation happens, she says that she just gets out of the shop feeling embarrassed. Her symptoms became worse and worse, and just over a week ago, she says that she feels anxious even before going out. And when she was in the shop, she began to feel a bit breathless and nauseous. She thinks that other people will think of her as stupid. And when she thinks that she got pain in her chest and worried if she's having a heart attack. But she remembered reading about panic attack, how people think they are going to die, so she told herself it's just a panic. It helped for about 10 seconds. However, she panicked again and she couldn't keep it together, so she left the shop. But later, she helped herself, went back and finished shopping by persuading herself that other people doesn't care about her. However, she says that she usually just avoids the situation that triggers anxiety. She may be diagnosed as panic disorder. She experienced recurrent acute attack when she was out shopping. She's having problem with breathlessness and nauseous. She also worries about having heart attack, and it causes behavioral changes. She usually avoids situations that gives her anxiety, and if she feels anxious, she says she just stays in. And this behavioral change also illustrates that she may be diagnosed as social anxiety disorder. She shows intense fear and avoidance of social situations. I could notice that she feels anxious about being humiliated and embarrassed. It suggests that she's having problem with social anxiety disorder. And for this disorder, gender could be one explanation, since women are more likely, twice more likely as men to have anxiety disorder, because women are biologically more sensitive and reactive to stress. Margaret reported that her traits as emotional and sensitive. She also says that she has this kind of dread and sometimes bursts into tears for no reason. With this Margaret self-report, I can figure out that she might have scored high on neuroticism. And those who scores high on neuroticism, more likely experience feelings like anxiety, fear, and depressed mood. And it leads to further development of panic disorder and other anxiety disorders. And interoceptive conditioning could be another explanation. It's classical conditioning of panic in response to internal bodily sensations. When she experiences anxiousness, she feels her heart beating fast. There she might have first panic attack and interpret with anxious apprehension about these somatic symptoms every time it happens, and thus leads to panic disorder. I would recommend her to have panic control therapy. It will help her to learn skills for controlling each of the physical, cognitive, and behavioral components of anxiety. She will engage in graded therapeutic exposure to cues she associates with panic attacks. During exposures, she will be deliberately exposed to physical sensations like increased heart rate, rapid breathing, to exercise such as breathing through a straw. This exercise will be done in the treatment sessions with therapist and subsequently by her at home. As she becomes less afraid of the sensations, more naturalistic activities will be assigned, such as drinking caffeinated beverages or watching scary movies. Since she is very keen to read up and she has once experienced of breaking the pattern of avoidance, she will follow this treatment very well and she will eventually overcome the anxiety.